The procedure of bloodletting. The night before the procedure, the patient was advised to eat lightly and bathe to increase the movement of blood. The day of the procedure, the patients were told to arrive with a calm mind. First, the physician washed the intended area with soap and water. Patients were often bled from the arm, so they held a stick to make their veins swell up, making the veins easier to locate. A lancet or a scarificator was then used. A lancet is a device that fires a spring-loaded blade into the patient's vein, while a scarificator has 12 rotary-driven blades, which causes many shallow cuts in the skin. The blood was usually caught in a shallow bowl. The procedure was over when the patient became faint. Drugs and bandages were then applied, and the area was washed with water. The physician prescribed relaxation and eating lightly.
Bloodletting has been around since before the 5th century. It is believed to have started in Egypt and then spread to Greece. Bloodletting is based on the belief that disease is caused by unbalance of the four humors: phlegm, black bile, yellow bile, and blood. Blood was removed from the body to restore the proper balance of the four humors. By the Middle Ages, both barbers and surgeons bled patients, using a fixed blade or fleam to make small nicks in the patient's skin. Bloodletting flourished in the 18th and 19th centuries. The use of the spring-loaded lancet, the scarificator, and the leech made bloodletting less painful for patients. Failures of bloodletting, such as the case of George Washington, in addition to the developments of new and more effective medical techniques, led to the decline of bloodletting in the late 19th century.
One of the methods they used for bloodletting was using leeches. This method would be used in smaller areas of the body, such as the mouth and ear. They would place the leeches in small glass tubes, called leech tubes, and the leeches would continue to drink blood until they were full. A few days later, they would do it again, but in between then, the leeches would be put in a glass or porcelain container. One factor in bloodletting was the time of the year. During the fall and winter, they would use the left side of the body, and during the spring and summer, they would use the right side of the body. Another factor was age. If you were old, you would be bled after eating, but if you were young, it would be before eating.
What would a medical practice be without a few rules? Bloodletting was not used during hot weather, as it would weaken the body and lead to more medical issues. Kids between ages of 9 and 14, as well as adults over 70, were exempt, as well as pregnant women and the critically ill. Bloodletting was primarily used because it was believed that bad blood was being removed and that good, better blood would replace it. Due to the nature of the treatment, people did die. This led to a small number of physicians that questioned it, and over time, it stopped being used.